So I'm really, really delighted to welcome Debbie and Jennifer to this Research Processes and Tools seminar series as our speakers for today. And I think it's really important, we've had 4 really interesting streams in our seminars. And this one is really about the nuts and bolts of doing research. Debbie has been working with me as a research assistant for more than 15 years. She's an exercise physiologist by training, and she knows everything there is to know about recruitment. Because of course we can list off things we need to do for recruitment, but it's a combination of knowing what to do and knowing how to do it, and having the personality that allows you to recruit and keep people in. And people refer to our studies as Debbie's studies, and they come often because of her. And then we have Jennifer, who has an equally a laudable reputation. She studied sociology. She's been working as a research assistant for over 20 years. And she now works for Miranda Nakla in child health. And I'm actually delighted to be a co-investigator on one of their studies, which is really looking at ways to help youth transition in type 1 diabetes. So without further ado, I think we'll all need to open our ears up to hear some really neat tricks of the trade.
Thank you so much, Kaveri, for that really nice introduction. Welcome, everybody, and thank you for joining us today. Jennifer and myself are very happy to help share our knowledge on this particular topic of research participant recruitment, and our subtitle is From Concept to Reality. So the overview of the presentation is start off with talking about the purpose of recruiting sufficient number of participants in the study. We'll talk about a few general terms, the steps that we need to do before recruitment can begin. We'll share with you our recruitment tips and experiences. And Jennifer is an expert in recruiting minors and vulnerable populations, so she'll talk to you about that. And we'll touch upon what will happen if you do have a low yield in recruitment. What can you do? And of course, retention of participants for the duration of the study. We'll talk to you about that as well. So why is it important to recruit enough participants in the study and actually keep them in the study? So the NIH has mentioned the goal of research is to obtain generalizable knowledge that improves human health or increases the understanding of human biology. People who participate in clinical research make it possible to secure that knowledge. So poor recruitment and poor retention rate can cause extra financial costs for the study, delays in the project, and a decreased understanding of the target population. And recruitment of enough participants is necessary for good quality research that tests hypotheses with confidence and minimizes bias. And so basically, without recruitment of participants, we won't have results. So general terms that I thought I'd bring up, we often kind of mix up between patient and research participant, but there is a distinction. Merriam-Webster Dictionary describes a patient as an individual waiting for medical care and treatment. And a research participant is an individual that has agreed to join a research project. So many of you know participant recruitment is a slow and challenging process. So we're here today to help give you some tips on perhaps how you can a little bit easier on your side for recruitment. Bear in mind that not everything we talk about might be applicable to your research project. There's many things that we found were helpful, and I'm hoping that you will find that as well. So the steps before actual recruitment, make sure that you have your GCP and SOP training. at the MUHC, you have to have those certificates in hand before you can actually recruit human participants. Of course, you have to submit the relevant REB forms, like the protocol that includes inclusion and exclusion criteria. You talk about, of course, your target population. What is your recruitment method? Places of recruitment, participant compensation as well. And of course, there should be a consent form that details everything about the study, and it should be written at a grade 8 level so that most of the population can understand it. It should include information about risk and confidentiality. The REB also wants to know what your advertisements, flyers, and letters will look like. And sometimes you do need DPS approval if you need to screen the medical charts in advance. So a little bit more about inclusion and exclusion criteria. You have to strongly think about who is your target population. You want to recruit the healthy or the diseased individual, perhaps individuals with cognitive impairments. What is the age of inclusion? You're recruiting adults, children under the age of 14, or maybe children from 14 to 17 years old. And which gender would you like to recruit? Is it only females for the study, or could it be both genders? And what is your sample size? So a few things would kind of limit you in deciding the sample size, the budget constraints, and of course, the need to get statistically significant results in your data. The list to recruit, we just put together a list, a simple list, and there could be many, many other places that you yourself have used. But here, myself and Jennifer, we've used clinic recruitment, GMFs or specialty clinics, community centers, daycares, schools, libraries, events, and arranged meetings like support groups and places of worship. Just bear in mind that if you recruit out of school, you may need to obtain ethics approval from the actual school board. And if you recruit at a clinic, you may need to obtain departmental approval. For example, if it's a clinic at the MUHC, and if it's an external clinic like a GMF, you may need approval from the Quebec Central Ethics Committee. So in your protocol, when you talk about recruitment, will it be direct contact, or in the age of COVID, a virtual recruitment? Some clinics now offer only virtual appointments. So you have to really think about how can you approach the participants this way. Before, when there was no COVID, I managed to go into the clinic and through the nurse or the dietitian, speak to the patients and then talk to them about the study and recruit them on the spot. Right now, I've been fortunate enough to have physicians who have agreed to screen their participants and ask, is it okay if Debbie calls you? And if that is the case, then the physicians will send me off their name, and Dr. Dasgupta looks for their phone number, and then I call the participants that way. A mode of advertisements could be a flyer, a poster, or a brochure, maybe even a website, a letter to the participant, and we can't forget, of course, social media. WhatsApp, newspaper, or radio ads. So I'll talk a little bit more on the promotional material. What we found is a flyer, poster, brochure really should be clear and concise. Put down easy to read phrases, and of course you have to include what type of participant you're looking for, and maybe phrase the study in the form of a question. For example, are you interested in giving your feedback about patient care? The flyer, poster, brochure should be colorful and also culturally appropriate. So let's say you want to do recruitment in the Indigenous population, well, of course, try to find pictures of people of Indigenous origin to make it more inclusive for them and appropriate. Of course, you would want to include your contact information. And also, if you include the logo of your institution or funding agency, that will make your poster and flyer more credible. Sometimes, depending on the case and the population that you want to attract, you might want to put up a poster with tear-off tabs. And these tabs should include, of course, your study name, the contact, and your phone number. And if appropriate, you might even want to put a QR code there so that somebody with a cell phone can just scan the code and quickly get your information without having to write things down. So what should you do if you have a study website? I've created one before where we can register participants. Again, you want it to be visually appealing and have a little blurb on what the study's about, the research team's contact information, and again, include the logo of the institution. And if you have the ability to do so, put a little bit of information where the participant can fill in themselves and register for your study. And of course, all of this has to go through REB. So depending, again, on your type of study, this might be an acceptable form of recruitment. Oh yes, one thing as well, some funding institutions may actually list all the studies that they fund. And what you can do on your own website is include a link to the funding institution website, again, lending to credibility for your study. I have also done methods where we mailed a letter to potential participants. And in the letter, we mention if you do not wish to be contacted by a member of the team, please let us know. Otherwise, we will be reaching out to you. So this kind of puts onus on the participant to say, hey, I don't want you to contact me. One thing that I found was very helpful was you use existing personal contacts to enhance recruitment. So you talk to the principal investigator of your study and ask him or her to talk to their physician colleagues so that they can mention things about the study. Remember to prepare a PowerPoint presentation for the staff and to really get them on board. What I found is if the clinic staff thinks that the study can be of benefit to the patient, they may be more likely to refer them to you. And Kadam et al. Mentioned that patients approached by their usual doctor are more likely to participate compared to if they were approached by a stranger. And when you do talk to the clinic contact, whether it's the nurse or the physician, ask them, what do they think they would prefer you to do in terms of recruitment? Some clinics have group sessions, and that would be amazing because you have the target audience all in one room and they can talk to all of them at one time. Sometimes you may, like, especially now in the age of COVID, as I mentioned, talk to the staff and see if they're willing to refer the participants to you. Or ask permission for the research staff to reach out to the participants by phone. And note that REB states that no one should be approached in the random way in a waiting room, but should be introduced by the member of the clinic staff, whether it's the receptionist, the nurse, the dietitian, or the physician. One way to go about it as well is to use your social network, friends, family, community groups, daycares, and religious groups to really spread the word. So for example, if you want to recruit moms and you are a new mom yourself and you're in a community group with a lot of moms who just gave birth, talk to the coordinator, see if the coordinator is okay with you posting on their social media page about the study. And when you actually do talk to communities, organizations, maybe you can even talk to their media reps and ask them, is it okay if I advertise about my study, either through your social media, or maybe perhaps you want me to send you printed flyers. I found that when I was recruiting in daycares, printed flyers, they would put one flyer into a cubby hole of each of the little kids. And so the parents could see this and reply. There's also community leaders who you can ask for help. Talk to them. They're well-respected individuals like religious leaders, elders, or even workplace leaders. These people can help you reach hard-to-reach populations, such as the low-income groups or the racial minorities. And the research teams should really gain confidence, like you did with the clinic leader or the clinic lead, gain confidence with the influential leader, because they can really help endorse or they decline the implementation of your project in their circle. And don't underestimate their power. And I actually learned that the hard way when I went to go to a diabetes support group. I had gone through the CLSC, and the person there said, "Oh, no problem. Come talk to our diabetes support group." And I thought I had spoken to, let's say, the president of the diabetes support group, but I was wrong. And I found that out when I got there. That this diabetes support group just finished another research project, and I think they didn't get a very good impression from that group. So when I went there, they really said, "Why are you here, Debbie? You're just here to take advantage of us, and you're not helping us at all." And I was really blown away, because the intervention for this project was free cooking lessons, and the kitchen was actually down the street from their support group. So it goes to show you have to find out who is the person in charge, talk to them, see what you think before you go. But if it ever happens to you that it occurs that they don't like you, or I should say, they don't like the study that you present to them, try not to take it personally. I remained as professional as I could be, even though I was pretty shaken by that experience. And lo and behold, 2 years later, somebody called me up and said, "Are you still doing this cooking class, this free cooking class for diabetics?" And I said, "No, I finished that a while ago." "And where did you hear about that?" "Well, that diabetes support group told me about that." So it happened to be the same one that rejected me. So I must have made a good impression, good enough for them to remember me and actually refer somebody else to the study, even though at that time they were not happy about me being there. So in terms of other places to recruit, it would be looking for local events. Where would your target population be present? Like conferences, support groups, community fairs. Again, ask the organizer if you can talk about your study, maybe have a kiosk there present to hand out flyers. And when you reach out to people who will be your contacts, whether it be in the community or in the clinic, remember, try to be nice and courteous. They don't have to help you. I mean, they are being really generous when they do. And we have an amazing team of research assistants at CORE. Go and ask each one of them what they think and where you should go recruit. When I first started out, that's what I did, because we had no type of training available. So everybody was very generous with their time when I went to ask them for help. And as well, keep a running list of the names of the organizations you contacted, who did you contact, whether or not they were willing to help you, and what did they accept as a method of advertisements? Did they like the flyers? Did they like printed form, or perhaps a PDF that they put up on social media. That way you have a keep tabs on all of that, and maybe a couple months later, if recruitment is still not up to what you want, you can contact these people again. And I pass the mic over to Jennifer.
Thank you, Debbie. So I'm going to talk a little bit about the actual recruitment, some tips on recruitment, different populations, recruiting teens and children, and then keeping them in your study. So a few tips when you're recruiting: be prepared, have your sales pitch. It should be quick and mention a quick summary of the study and what the goals are. Of course, have your relevant documents and your eligibility criteria, your consent form, obviously, and your recruitment log, and know your consent form. Oftentimes you're giving them a consent form and they have it in front of them and you're facing them and they're going through it, and you want to be able to explain all the sections of your consent form without, referring to it too much. So be prepared with that way. Of course, be polite and courteous and respectful. This could set the tone for the whole study. If they meet you and they like you, this could totally set the tone. So, and remember that these potential participants don't have to join your study. They're volunteering their time. So treat them, of course, with respect. And they may refer you more patients, or more participants rather, which would be great. Next slide, please. Debbie? Perfect. Thank you. So Patel and colleagues had talked about the importance of interpersonal skills and displaying compassion, approachability, and tactfulness when recruiting your potential participants. I think tactfulness is a very important one. So if you happen to be in that waiting room and someone has maybe received some difficult news, maybe they're a little bit tearful, perhaps they're not the participant to approach right now. In the case of children, if a child is having a tantrum or just not having a good day, maybe that isn't the time to go and recruit them either. Be mindful of cultural traditions. Like Debbie had mentioned about Indigenous communities, maybe talk to their elders first and see that they're open to having someone come into their community and recruit. And of course, be professional. Don't get discouraged if they say no. I think Debbie had a good example of that people might come back to and see them, to see you if you left a good impression. So, and patients don't have to say yes. So if they refuse, don't take it personally. Next slide, please. Be positive. So it isn't your fault, hopefully. Hopefully you haven't put them off the study too much. So yeah, be positive, and it'll go a long way, I think. Next slide, please. Be persistent. So in this age of COVID and remote recruitment, you may have to call them a few times before you reach them. You might be playing phone tag a little bit, and it's possible that depending on your study, you could approach 4 or 5 people before one of them agrees to participate. And out of those ones that agree to participate, only a few of them might be actually eligible to make it through to the end. So you have to be persistent in your communications. And as Debbie mentioned, if you're in the clinic and you're relying on clinic staff, doctors, nurses, to mention the study for you, you might have to be physically present for them to remember. Everyone's kind of busy, so they might not remember that you have this study going on, but if they see you, they'll go, oh yes, I have to mention that to my patients. And of course you have to be flexible because potential participants are busy. They are working, maybe they can't take a personal call during work hours. They have family commitments. So if they ask you to call them back at 7 p.m., for example, that might be something that you're going to have to be flexible about, because obviously we want to recruit as many participants as we can in our studies. And of course, be quick to respond. if they've reached out to you by maybe one of those pull tabs that they saw on your flyer, or they've gotten your email address from someone else who's participating, and they've reached out to you, respond in a timely manner. You don't want them to forget who you are or why they contacted you or what the study's about. So be timely. Next slide, please. And of course, be patient. Allow the participants to ask as many questions as they want. You want them to be comfortable with this project, and you want to be confident that they understand what they're undertaking. I found a clinical research study where only 50% of the participants understood what they were consenting to. They actually presented that as a positive, and I feel like that's probably not quite enough. You really want your participants to know what they're consenting to, what the steps are, what are involved in this study, and of course the risks and the confidentiality involved as well. And I'm talking about recruiting children. I came across another study on the utility of the consent form for parents who were consenting their children. And 67% of them stated that they had made their decision before even receiving the consent form. So going back to what I was saying about your sales pitch, have all your information there, be confident in what you're talking about and what the steps are for your study. And that might be enough. And of course you want them to read the consent form anyway, but you know, they might be taking their information from your sales pitch. And only 25% of them reported that they had found new information in the consent form after reading it. So you want to make sure that you're touching on all topics when you're giving them your sales pitch. Next slide, please. So your study might recruit vulnerable populations. So this can include severely ill or unconscious patients if you're recruiting, say, in the ER or on the wards, or it could be cognitively impaired individuals that can't consent for themselves. In this case, you would need a legally acceptable representative to sign on their behalf. And in the case of the unconscious patient, they would need to be consented as soon as possible after they've regained consciousness. In the case of low-sighted or blind participants, you can have an impartial third party that can read the consent form to them. And in that case, you would get verbal consent and from the participant, and the witness would sign the consent form. And I think this applies also to participants or patients that might not have that grade 8 reading level and might not want to disclose that to you. They might be embarrassed about it. So if they want to have someone else read it to them, or they want to look it over with, or to talk it over with their family. And I think that's one of the important things about going through each section of the consent form as well. So that, you know, if they don't necessarily want to disclose that they have a bit of trouble reading, that you've gone through all the sections as well. Next slide, please. Here in Montreal, we live in a multicultural, multilingual city. And if you want your study to represent your population, you may come across potential participants that don't speak English or French. Depending on your study, and if that's not part of your exclusion criteria, then you can have an interpreter or translator come and translate the consent form for them. In that case, the interpreter and the participant would sign the consent form. And we're lucky here at the MUHC, we have a sociocultural department that has translation services or interpreters for a fee. And the contact information is there. So if you have it in your budget what I want to say, sorry, is that you want to make sure you have that in your budget if you do have a large population that you would need interpreters for. And of course, if you have a language, a population where there's many people that speak a different language, Spanish, for example, you know that you're going to have a lot of Spanish participants. You may want to have your consent form actually translated into Spanish for them. Next slide, please. So recruiting children and teens. I mean, recruiting children is much the same process as recruiting adults, but it can be a little bit more delicate. Depending on your study, there's parents that are obviously concerned about what might be involved in the research project. So you have to be respectful of that. Here in Quebec, the age of consent for research projects is 18 years old in most cases, which kind of surprises a lot of families. So in some cases, teenagers that are 14 years and older could sign the consent themselves if the study is considered minimal risk. So I'm working on a study right now of teenagers with type 1 diabetes, where the intervention is group education sessions. So this was considered minimal risk. So the teens are allowed to sign for themselves. And they're also going to be turning 18 for the duration of the study or during the study. So in a case where the parents do need to sign for them and they turn 18 during the study, they will need to be reconsented so that they can sign for themselves now that they're 18 years old. Children who are over the age of 7 and who are able to understand and are capable should sign an assent form. Now that might be part of the bigger consent form, or they might have a form of their own to sign. And children under 7 should still have the study explained to them in language that they can understand. And they may even want to sign that assent form. And I think that's probably okay as well. Next slide, please. So a few things to remember. Like I mentioned, children should have the study explained to them in language that they can understand and answer their questions. Kids have very interesting questions sometimes, questions that adults don't think about, but are pertinent and important. So answer as many of their questions that they have. And of course, treat them with respect, just as much as the adult signing for them, because they are your study subject. And include them in as much of the decision-making process as you can. So be respectful of their wishes as much as possible, even if it means that you have to apologize for not respecting their wishes. An example of this is that I was recruiting for a study that we had to do blood tests. And I don't know of a whole lot of kids that enjoy doing blood tests. So obviously that's something that they didn't really want to do. And part of the blood test was clinical. So this is part of their clinical workup. So they would have to do this blood test anyway. So, you know, we gave them choices. Do you want to sit in a chair? Do you want to sit on your parent's lap? Do you want to lie down in the bed? Do you want to have some numbing cream like EMLA to put on so that you don't maybe feel the needle as much? Do you want to watch a video while we're doing it? Do you want to count to 3 and let the nurse when we're ready to start? So all these little choices don't seem like a big deal, but it gives the child autonomy, it lets them be a part of this decision-making process, and it gives them something that they can, talk with you about and make decisions on. Next slide, please. So if you're running into trouble, why are the patients saying no? The team should meet regularly to see how recruitment is going, see if your strategies are working. Are you maintaining a good recruitment flow? And if you're not, why? Is the study too complicated? Are there too many steps? Is there too much of a time commitment? Are the questionnaires just too long? Are there too many appointments involved? So as I mentioned before, people are busy. They can't necessarily take the time off work. So you might consider combining their medical appointments with their research appointments, or doing things after hours, in the evenings or on the weekends if possible. They might live far away, or the commute is too long. They have to take too many buses, trains, whatever to get in. In the land of COVID, we've learned that doing things virtually is definitely possible, and sometimes easier. So consider whether a virtual appointment is possible for your study. And then alternately, home visits is something that you can do. It might be a little bit more difficult now during COVID, but it's still possible. So if you can do a home visit, think about that and maybe put room into your budget for that. Does the family have other family commitments that are preventing them from joining. In the case of recruiting children, there might be other children in the family, and they don't have anybody to look after the other child while the participant is at their clinic appointments. So you might want to consider childcare. Can you have a volunteer come and look after the other child while your child participant is doing what they need to do for the study? Next slide, please. And what do you do if you can't recruit enough participants? So in that discussion that you're having with your team looking at recruitment flow, do you need to maybe loosen the inclusion or exclusion criteria? So that's obviously something that you're going to discuss with your PI and have the RIB involved if you need to make any amendments. Or maybe shorten some of those questionnaires. Do you need all of them? So things that you guys can discuss. You also might want to widen your recruitment net. So looking at going multi-centered. If there are other institutions that have a large population that you can recruit from, community centers, social media groups. And this obviously does require an amendment in the REB as well. Next slide, please. So now you've recruited them. How are you going to keep them in the study? Next slide. Incentives help. Pay for their parking if they're traveling to the hospital or your center, or pay for their travel if they're taking public transit. Offer a gift card, as an incentive for their time that took to do all the questionnaires to be part of that intervention group. And in the case of children, offer some small toys or games or stickers, give them 2 or 3 choices, not too many choices. And I would avoid offering candy or treats of any kind, just because you don't know what their allergies are or if their parents want them to have treats. So stick with toys and games, and most of them are happy to get that. And then remember that incentives can't be considered coercive. They should be small gestures that aid in the participation, and of course should be fair and appropriate, and the REB will help you with that as well. You could send holiday cards. So just happy holidays. Thank you for being part of our study. Your continued participation is important. All the best for the new year. If you have an RCT like I'm involved in right now, the control group might not be doing too much in the study. They might not have too many steps that they have to do. But if they're coming for scheduled appointments, you can say hi to them while they're in the clinic. Just see how they're doing. Mention that I'm going to contact you again in 2 months, 3 months for your next step, and remind them of your contact information if ever they need to reach you. And in the same vein, to text them or phone them or check up on them, or remind them of upcoming appointments. And if I've learned anything over the past year recruiting teenagers, they preferred being texted rather than called. So send them a text message. You could also send periodic newsletters with study updates. So there shouldn't be too many of them. We don't want it to feel like spam. Or you could use that social media platform or that website that Debbie was talking about, if your study has a website, to put any information up on there. I found a study on cancer research that said 75% of the respondents said they wanted to be informed of the study results. We who work in research know that the results could take years. And they don't often understand that. I've spoken to a lot of patients who are like, oh, well, when are we going to know the results of this study? And I kind of cringe and say, well, it probably won't be for another few years. And they're surprised. They're like, yeah, but I'm almost done the study. I'm like, yeah, you are, but I've got lots of other ones who are just starting. So it takes time. But you can send updates from preliminary results if you have some. And even if it is a few years later, you can send them an email with those study results. And of course, keep the participant informed of any new information that could impact their willingness to continue in the study, or any risks that have come up over the course of the study. And that's obviously something that should be communicated to them in a timely manner. And of course, respect the participants' decision to withdraw if it comes to that. People have all kinds of reasons for wanting to join a study, and they have their own reasons for wanting to leave a study as well. And you have to be respectful of that. Offer that they can come back at any time or contact you at any time if they've changed their mind, but respect their decision to withdraw as well. Next slide. So any questions?
Thank you for a great overview, both of you, Jennifer and Debbie. And I think that Teresa has a couple of questions. Are you still there, Teresa? I don't know if she's still on. If you are, Teresa, you can unmute. Otherwise, one question she had was in Debbie's slides, she spoke about the 14 to 17-year-old group, and Teresa was wondering about the particularities of that group. I think, Jennifer, you went through many of them, but if you wanted to summarize again.
Yeah, I don't know that they're particular necessarily, but other than that, they could potentially sign the consent form for themselves. And if the study allows it.
If the study allows it. And I guess the other issue is if it's a more complex study, they can't necessarily, it would
right,
be,
if it's a drug trial or something like that, then their parents would, I think, still need to consent for them. But they would sign that assent as well.
Perfect. I liked the under 7-year-old signing. I thought that was super cute. So.
I've had it happen. I've had them come to me and say, well, I want to sign it too. And it's fine by me. Go ahead.
Go ahead. Yes. There's a question from, I don't know if I'm pronouncing this correctly, Lovmine Genot. And her question was, in which situations should an impartial witness be present during remote consent discussion? And how should impartial witnesses be selected? An interesting question. I don't know if Jennifer or Debbie, you have an answer to that.
I think well, an impartial witness could be someone of their choosing, right? Because if in the case that they're reading the consent form to them, if they're blind or if they have low literacy, if it's someone that they trust, a friend of theirs or a spouse, that they can, that person could be trusted to read that for them. It could also be someone from the hospital, but it shouldn't be someone associated with the study, or the treating physician or something like that. Does that answer the question? Did I get all the points of it?
That means you want to yes, you did. Thanks, you. And then Teresa had a couple of questions about recruitment websites. I guess this was for Debbie, but it could be for you as well, Jennifer. So have you created recruitment websites yourself? And does CORE provide support for this? So I can answer the second part of the question. So most of the websites have been created within team. We don't have a particular resource or platform for website development. Might be something to think about in the future. But Debbie, do you want to comment on recruitment websites and what we've done?
We did find a website host where we can type in our own website address that we wanted to use, and we designed it ourselves. And it's very easy to use, Teresa. So if you want any help on that, I'd be very happy to help you with that. But they have all sorts of designs you can do, colors, different tabs. Of course, you have to do it in French and English. The particular site that we used, I believe, is Weebly. And it's very nice. You can put whatever you wish in there. Of course, it has to be REB approved. But it's very easy to use. And what happens is when people go on there and register, their information gets sent to you through email. and then you can respond back to the potential participant that way.
So Andrea Van Holst has a very interesting question. So she says that they're having trouble recruiting healthy control adolescents in one of their studies that have extensive or somewhat invasive measurements, and they weren't able to go through public schools. So she's wondering if you have any thoughts around that, maybe Jennifer, in terms of recruiting healthy adolescent controls. Where would you go to do that?
So I actually worked on a study where we were looking for healthy controls, and it was in the hospital because we were wheeling around a pulmonary function machine. So it had to be within the hospital. We couldn't go anywhere else. So we ended up going to orthopedics or ophthalmology or, you know, the kind of departments in the hospital where they're not necessarily chronically ill or but you know, anyone can break an arm, unfortunately. So yeah, you could try some of those departments, or maybe siblings. If they happen to be coming to the hospital with one sibling, you can ask, you know, the other one's kind of tagging along for the day. Maybe they can, you can recruit those ones.
What do you think about any pediatric clinics that are outside of the MUHC? That might be another spot as well.
And Miranda mentions general pediatricians as well. Yeah, I think also maybe social media-based recruitment might work, reaching out to local teen groups or chat groups, possibly. Nazila Hassanbadi has a question. She thanks you for the talk, and she wants to know if it's permitted to use Google Form Drive to collect and store the participants' information. I have some comments on that, but do you guys want to talk about that?
Debbie, I think you shouldn't. You should be using
No, I don't think the REB would approve of that.
It needs to be on a secure server. So
yes,
that's what
right.
Password protected, secure server, backed up somewhere. Yes, safe. In Montreal or in Canada, I would suppose. Yes.
Yeah, you can use, so here at the MUHC, you can use RedCap, and we have our secure server. You can use secure servers elsewhere. You have to make sure that you don't have any participant identifying information with the other information you're collecting. So you have to keep those forms apart. But Google Drive wouldn't be considered a secure site. So yeah, you're better off using RedCap or a provider that has the information safely stored. Teresa has a comment on your point on the experience of people with previous recruiters is spot on. I tell students in global health that they are carrying the Canadian flag and they are paving the way for future students and researchers. So I think she really liked the comment about how you conduct yourselves as the face of this study is so important. And then Teresa had another question earlier about if the usual doctor could be involved in recruitment, if that was permitted. And my comment to her in the chat was they can say a couple of things about the study, but they're not actually recruiting in. Do you want to comment on that, Debbie?
Yes, so as I mentioned to you, in the times of COVID, I can't really go into the clinic to recruit. So I asked the treating physician if they don't mind saying a word about the study and say, is it okay if Debbie contacts you? And then I do the explaining of the actual study, the nitty-gritty parts of it, A, because the physician might not totally understand what our recruitment criteria is, and B, he or she might not have the time. They would be a good champion to kind of, you know, say to the patient, it might be a good study for you, but I often let the patient decide themselves because they will be the one implemented in the study.
So there's a comment from Luan Tran to everyone. The MUHC has a Nextcloud server. So that's an MUHC server, so that's good. That is available for all staff or students. The IS department told me that it is encrypted, secure, and that patient nominating information can be stored here. And I think that's true. And we're trying to figure out about the Nextcloud, how it applies to RI-MUHC. But if you have access to that server, for sure, a hospital-based server is a secure site. Nonetheless, you wouldn't want to put identifying information alongside other information. You want to put them in separate files. But thank you very much for that, Luann, that comment. Does anyone else have any comments or questions? So I'd really like to thank Debbie and Jennifer, your huge assets to CORE and the RI. We really appreciate you taking the time to give this talk. And I hope it's the first of many talks by our so valuable assistants and associates.
Thank you.
Thank you.
Thank you very much.